Hi, my name is Susan Meyer. I am currently an instructor for a radiology program in the state of Colorado, and I work with multiple different areas to help. Um, I work with KHEC to help bring people into rural areas of Colorado for healthcare. I'm also working with the Veterans Group to try to get help for veterans.
Great. Well, I know you work with a lot of students and you are an amazing professor. Can you let us know what you think your students are learning from this opportunity of COVID?
Currently, we've had to change our whole concept of how we are learning the process of radiology, doing everything online. We have learned a lot from it just in the fact that a lot of them were in clinicals when it first started coming out. Our students did not get pulled out of clinicals until March. And so they did actually get some of the front line that healthcare workers were seeing, understanding the concepts of protection, PPE equipment, the importance of making sure that everything was clean between patients. And currently, now with some of the students getting ready to graduate, they're finding that um, jobs are a little hard to come by right now, but they expect that to open up very soon. Just working in the field of radiology or in healthcare in general, a lot of hospitals, especially in the rural part of Colorado, a lot of the employees are getting laid off because they don't have the elective stuff coming in. And so they're only working the hours just to take care of the COVID patients. And with this, the students we have been discussing about the different how this affects healthcare in general, how it affects our careers, how it affects our life. Um, the biggest thing I think they have pulled out of it is the fact that what type of precautions they need to take when they leave work and go home to families. Um, I have one student that's pregnant and she went through all this. And so we did quite a bit of research on, the possibilities of what could go on if a pregnant woman gets the COVID. And unfortunately, someone in her family did test positive. So with research, all the students jumped in and kind of did research for her and found out that she actually is fairly safe and to keep her distance, and which she is doing. But it's been a crash course in protective equipment and how to deal with an epidemic like situation. So, but I think that they are learning a lot, and the hospitals have been great to help us.
Do you think this will make your current students a stronger group of healthcare workers in the future?
Oh, definitely. I think they're going to, they were at the front lines when it was coming through in January, February. And even at that time when we weren't sure what was going on, they were diligently making sure that patients were masked and that everything was wiped down between. And so the, the preparation for exams and everything, they actually put so much time and effort into learning the proper techniques, how to manipulate x-rays so that there wasn't a lot of contact, which is kind of hard to do in radiology because so much of our profession is patient contact. And so they can now talk a patient to get them in the position they want without even touching them, which I think is an amazing thing for a technologist to be able to do. So yeah, I actually think it's made them much stronger in their communication skills, definitely, but they're also a whole lot more aware. And everyone in healthcare gets a little lax sometimes about washing hands and everything like that. And it definitely ingrained in them a hardcore of making sure that every patient is not that we're saying bad, but every patient is a possibility of having something that could be transferred. And so I don't know if that's a good thing, but it's good for during flu seasons and stuff like that because it does keep the numbers down.
So as we move forward, Are you seeing that the COVID is helping us identify current gaps in educational preparedness for students in your program? And if so, what might they be?
I just actually had a meeting with the Morgan Community College, who I work for. And in fact, they're actually looking at making quite a few of our classes online, which is going to make it wonderful for people outside the communities that would have to travel in, and how we can do more online learning. Now, with my program, some of the classes can be online and some of them are going to have to be hands-on because we have to be in class to learn procedures. But we're thinking that we can actually really improve the educational system with online teaching. Um, I didn't think that I was going to be able to, get the information across, but we're finding all kinds of new ways to work with students. And I think actually this has made a huge, well, it wasn't a jump, we were pushed into online teaching, which I think is actually going to really benefit, especially people that are outside the big cities and in smaller communities that can't move due to, you know, their spouse's jobs or children or things like that. I think it's actually going to open a lot of opportunities for people to go back to school that wasn't an option before. I would have never said that I would offer my program online, but I think I actually could, with the understanding that maybe every other week we have to meet for labs and stuff like that, but not in every week or 2 days a week like it has been.
Wow. I know you've been tracking what's going on in the state of Colorado. I'm just interested in your perspective regarding the difference between what's happening both in healthcare and maybe education on the Front Range versus what's occurring in the rural communities. How is that different, or is it?
In healthcare, definitely, just we don't see the bad cases of COVID out here. If we get a COVID positive patient, unless they're um, if they're needing to be on a ventilator, then they're going to be shipped out to the Front Range. We do the minor cases. We do the ones that need to be watched very carefully. They may be what we call short-term critical care, which means they may be on a ventilator just long enough to kind of get them over the rough spot. But the severe cases of COVID-19 that they're on a ventilator for a considerable amount of time, those are all getting shipped to the Front Range, to the bigger hospitals. And the reason why is because they have pulmonologists on staff there, which we don't have out in the smaller communities. And right now, the physicians aren't traveling into the smaller communities because they're being a little careful about where they're traveling. And the bigger hospitals just have the equipment. For schooling, I think Colorado in general we're all in the same boat. Front Range versus smaller colleges, high schools, things like that. I feel that Morgan Community College was actually pretty ready. We do quite a bit of global teaching, which means we teach all over the United States. And so we had a really good system in place, because in order for the smaller colleges to keep up with the bigger universities and bigger colleges, we had to offer global learning and things like that. So we had kind of already made a couple steps forward into online teaching. Programs like mine in radiology, we hadn't, but because it was already set up and we had really good input from teachers that were already teaching global classes, I think we had a really good jump start on some of the bigger colleges and universities that insist that all their students are on campus. So yay for small communities. But yeah, I think I feel that we jumped into this and we made some incredible advancements very quickly for our students. So I was really happy to see that.
Oh, that's wonderful. So let's talk a little bit about these students. So you had shared with me that you had students currently engaging in practicums and working in the hospitals. Were they asked to leave, and what impact would that normally have had on their licensure versus what we might be seeing in the graduating class in May?
I run two classes. My program is a 2-year program, so I have one class graduate every May. I'm very blessed to say that the class that's going to graduate this May, we had worked with the Higher Learning Commission in the ones that accredited our program, and they said if they can have met 90% of the clinical hours that are required to graduate, go ahead and let them graduate. They just have to finish their didactic classes. And thank goodness my students had met that 90%. And unfortunately, for the first year, they weren't kicked out of clinicals, but the college felt it was in their best safety that they would need to leave clinicals. The hospital felt that by providing them extra PPE was going to diminish theirs because, of course, we have to go in with a technologist. And so it was a general consensus between the schools and the hospitals that the students were to step out, and for their safety as well, and totally understandable. So the second years, we were into March far enough that they had met that percentage to graduate. My first year classes, they are only at 60% of their hours required. And so as soon as they let us back into clinicals, they're going to have to play catch up this summer. Hopefully we can get into clinicals and they'll have to play catch up. But for the majority, nursing, physical therapy assistant, all the other programs, they are actually finding ways to help get some hours, whether they're doing practicums online. I know some of the instructors are doing their labs and things online about different testing for phlebotomy. It's kind of hard for us to do that in X-ray. So we're going to have to just make up a bunch of hours this summer. And I know a lot of the X-ray programs in the state are going to offer labs in the evening and on weekends to help make up some of those clinical hours that were lost. And I think the majority of nursing, X-ray, physical therapy assistant programs like that are going to be doing the same thing. I don't know of too many programs, especially at the community college level, that the class that was supposed to graduate in May, they might get postponed a couple months, but they're not going to have to go another full semester. So that's a plus for the community college system in Colorado.
Well, that's wonderful. What's been the most difficult adjustment that you have experienced and that your students have experienced through this whole COVID crisis?
For me, I'm one of these people, I want to be in the classroom with my students. I feel like I've lost some of the connection I've had with them, although, we do FaceTime on my phone, and we do WebEx. We do WebEx or Zoom, and we meet at least once a week and talk. But my favorite part of teaching was actually the one-on-one connection and actually being in the room and learning about their families, and just there was a camaraderie there that was really nice. And I really, really miss that. And I feel really good to say that my students said, "We miss you, Susie." And I thought, thank you. Because, and I work with a much smaller class than a lot of, I have a small program. And so I only have 20 students, but we're more like they're more like my family or a second family than students. So, because we've been one-on-one for 2 years now. So I kind of miss that. So, and I think they kind of miss having their friendships because they've all been separated as well.
Right. So you're an educator, you're a provider. How do you exercise leadership in this time of crisis?
I think it has a lot to do with my students. I mean, and I am pleased to say that they come to me just not for school stuff, but I've got a bunch of students getting ready to go out into the workforce, and we'll do FaceTime time on and we'll talk about what do we need, what do you have to do. We've practiced interviewing online because that's going to be a whole new concept now. A lot of the interviews now are being done online. And so what can we do to make those really come across really good? It's very easy to put your personality out there face to face. It's a little harder to do that when you're online. And so we've been practicing, and of course, it means a little bit more time, in the evening, but that's okay. And my group of students, because I have quite a few non-traditional students in my program, the leadership part is easy. I mean, because they pretty much take the reins, and I jump in if I see something that might be, might benefit them. But actually, it's an amazing group of students.
What do you want history to record about this event, both in Colorado and locally, for the rural resilience that's occurring?
Rurally, I think we're doing amazing things. Boy, talk about this was not working up to something. This was 1 minute everything's fine, the next minute it's in a totally 90-degree change of everything we've been doing. And I was impressed at how it really didn't disrupt my classes much by having to go online. Clinicals, yes, it kind of disrupted the clinicals, but for classes wise, it really didn't put much of a hiccup in our classes. And I think historically, we're going to show that, we're a whole lot more resilient than we think we are. So,
So would you
excuse me.
say you've learned a few new things along the way in the last 6 weeks?
The poor IT guy at the college. I bet I called him about 100 times the first couple weeks because I have definitely become much more efficient on my computer, which I used it a lot before, but I have gotten I'm impressing myself how much I have learned, and my students, because they're so much younger than me, I'll say, I'm not sure what I'm doing, and they'll call and walk me through a computer issue. So that's pretty nice.
How
Sorry,
are
I got allergies.
the allergies? As long as you're not sick, that's the good thing.
No, I'm not sick, just allergies.
Yeah. How will this experience influence you in the future as an educator, but also as a clinician?
As an educator, I think I'm going to be way more prepared because I'm going to be able to teach in class. And if we have to switch to WebEx, I'm going to be able to do it in a snap. It's not going to be a problem. In fact, I think we're going to go more computer based in the classroom because I find that the information's getting transferred much easier. And not only in the classroom, we can always be face to face, but since we have gone to WebEx now, a lot of the chapters and things are outlined a little differently. The testing is so much different than what we usually do in the classroom. And so I think if we use both of them together, I think it's going to make for a much stronger teaching environment for any program, any class. And in the healthcare, I think, I tell you what, it makes you a whole lot more aware of patients coming in and that we need to be a little bit better prepared. I know that I work at a facility, and we thought we were prepared, and we weren't quite as prepared as we would like to think we were, which I think is nationwide, especially in rural areas. I think that we always think, well, that's not going to happen, or the big hospitals are there to back us up, and that's not always the case. And I think generally, if you watch the news and listen to the people out there talking, I think hospitals are going to have a much more secure base for protective equipment and better outlines of what's going to happen if God forbid, another pandemic hits, or anything. I think it's going to be much better planned out. Like I said, we all get a little bit lax sometimes, because we're just doing our job. And then, someone throws a cog in the wheel, and it makes you rethink that you need to never let your guard down, ever.
Have you any
It's always better to be prepared.
have you had any aha moments or things that you're surprised that you've learned after being in this environment for so many years as an educator? Have you had any aha moments?
Oh, definitely aha moments. Just the computer itself. It's kind of like, oh my gosh, I'm old, but I still know I'm learning so many new things about my computer. And the greatest aha moments are when I'll be saying, I'm not sure how to do this, and a student will call me and walk me through it on my computer. And it's like, well, that wasn't that hard. And I've always just been a little terrified. I work in a field that is nothing but computers, but it's a very condensed, like radiology, and the computer world out there is amazing. And these students are walking me through, and it's kind of like, well, that wasn't bad. And then we find different ways that we can use that in our classroom. So that's wonderful. In healthcare, every time I go to work, it's an aha moment, because healthcare, you never say always or never, because you will be proven wrong. So people have asked me, well, if you teach full time, why do you still work in the healthcare field? And I said, because it changes so fast. If you don't work in it, you're not going to know what's going on, because just in radiology, in the 40 years I've been doing x-rays, I have seen amazing changes. And if I don't know what's going on, how do I teach my students that? So, and I like working in radiology. There are days I'm thinking, why am I doing this? And there are other days it's just amazing to see how healthcare in general has just advanced. It's pretty cool.
You have so much on your shoulders. You are engaging in so many programs. You volunteer for veteran service groups. How do you decompress at night?
Okay, I have animals. So I have dogs, I have chickens. I do gardening. My Zen garden is to be out working in the yard. I know people think I'm crazy when I say that, but if I can be, and it's kind of crazy that my jobs are all inside, but if I can be outside, you know, sitting on my patio, watching my chickens, playing with the dogs, going for, if I'm outside, then I'm okay. So to be honest with you, I think I would go crazy if I had to sit at home and people say, why do you do these other things? Because I don't want to just sit. I mean, every once in a while, it's nice to come home, put your feet up, watch a movie or sit on the patio. But the rest of the time I want to be out moving and doing stuff. And I guess that's how I've always been. And I hope that day never comes that stops.
Awesome.
So.
Any last words or thoughts you want to share for the future?
I'm going to ride out the storm. I'm sure that there's a whole lot more to learn and see and figure out. And everybody says, oh, the world's getting so scary nowadays. Well, my parents said it, their parents said it. I'm sure I said it about having kids. And I'm sure my children are going to say, oh, this is a scary time, don't have kids. We always survive. And it always seems to somebody out there has a great idea, and we seem to jump on board, and we keep going along. I mean, it is a scary word out there, but I don't think I'm going to hop off the roller coaster quite yet. So.